folks. Thanks for sticking it out to the end. I do know that I'm the person that's standing between you and dinner, so I will try to be expeditious. But I do have some interesting points. I hope that will be helpful for you. And if anything, I hope that some of these stats and evidence will help you actually live a longer and healthier life and help your employees and team members live a longer and happier life as well. So I'm going to talk a bit about some global health trends that we're seeing all around the world. I'm not just going to talk about mental health, but mental health and behavioral health is certainly my specialty. And I'm going to talk about some pragmatic things that you can do about that and lessons that you can bring back to the industry. So I'm the Chief Mental Health Officer at TELUS. TELUS Health is a bit of a Canadian success story. People usually think about the telephone company or the internet company when they think of the words TELUS. TELUS Health, though, is a subsidiary of TELUS and is in fact one of the world's largest healthcare companies now, with over 175,000 clinicians serving 30 million people around the world just for mental health alone. When you take into effect all of the medical services and healthcare services we provide, pension management, electronic health records, it's actually more like 75 million people that we help all around the world. And a colleague of mine reminded me recently that we help someone every 10 seconds, basically, at this company. And so a lot of the folks that have been here at this conference are actually clients of TELUS. They use our behavioral health services, mental health services, counseling support, occupational health. We are there for them. So we actually survey people all around the world, about 5,000 or 6,000 people each month, all around the world in every country, in every different language, and we ask them about their health. And so we've been doing this since before the pandemic, so we have a good baseline measure, and then we've been doing it since. And what we found is that the pandemic basically crushed everybody's mental health, which is not entirely surprising. And then we saw it recover, which is great to see. We actually saw some recovery. And now, it's starting to slip back again. And so we're finding over 40% of people are reporting feeling like fatigued or burned out or tired at the end of their workday. And about a third of people are getting flagged as having a high mental health risk. High mental health risk meaning, at a high risk of getting like a clinical disorder like depression or anxiety, or burning out from work or leaving the workforce altogether. And so there's a couple of health trends that I'm interested in as a healthcare professional working at a global health firm. One of them is chronic diseases. How many of you have in this room have had trouble finding a family doctor? Or even have a family doctor? Well, so my sister's a family doctor, and she would tell us that one of the reasons why it's so hard to find a family doctor right now is that family doctors are the quarterbacks for dealing with chronic diseases. And right now in Canada, we have a serious chronic disease problem. Accidents aren't what kills most people these days. It's things like heart disease, diabetes, cancer, and dementia, actually, that have the greatest burden of illness on Canadians. And since family doctors are on the front lines of chronic disease, they're the ones that have been hit by this burden, especially post-pandemic, and they're burning out as a workforce. And so we're seeing fewer and fewer family doctors, fewer and fewer people going into family medicine from medical school, and so that leads to this shortage. We're also seeing a lot of stress and anxiety, and that's leading to trends like quiet quitting. So people still showing up to work, but they're not really quite there. That's something we're seeing with the stress and anxiety trend. A lot of sick time claims, disability claims, and then drug use, which I'm going to focus on in a second. And then finally, social isolation actually is, public health officials are saying now that this is sort of the epidemic of our times. Social isolation, loneliness, social disconnection. The US Surgeon General is quoting that it's as bad for you as smoking 14 cigarettes a day. So being lonely, not having friends, not having social things to go to, not having social events to look forward to, is as toxic for your health as smoking packs of cigarettes a day. It worsens chronic disease, it messes up your mental health, and like I said, it's considered the epidemic of our times. Talk a little bit about drug use. So this is a mining conference, so I know that there is drug testing that happens on the site. And usually the way that we figure out how much people are using drugs, and I'm talking about drugs like cannabis, fentanyl, MDMA, like all the stuff out there, you have to either ask people or you have to test them. Well, now we have a new way of actually figuring out how much people are using in terms of drugs, and what that is that we actually test the wastewater in the sewage treatment plants of our cities now. This is a technique that we discovered during the pandemic, could be used to track the prevalence of things like COVID-19 as well as the flu virus. Basically, we can detect these viruses in the wastewater, and now we've learned we can actually detect the metabolites that come out after you've used drugs. So we know actually exactly how much people are using drugs, and we don't have to ask them anymore. We can actually track this down. And so this is a very tiny slide that you need an ophthalmologist to help you read. So I'll just tell you what's on it, which is that these are some of the major cities of Canada: Vancouver, Edmonton, Toronto, Saskatoon, Montreal. We've thrown in a couple, Halifax. We've also thrown in a town that is more resource-based, which is Prince Albert, Saskatchewan. And these just happen to be the cities that were studied for this particular study. It's available on the StatsCan website. This isn't controversial stuff. It's all publicly available. But what it basically shows is that Vancouver in particular is off the charts in terms of using fentanyl. There needs to be a different scale for Vancouver, but it's present everywhere. There's a lot of fentanyl being used in Edmonton, fentanyl being used in Toronto, and even in Halifax. It looks very small in this chart because of just how grossly out of proportion Vancouver is, but it's definitely there. And then if you look at cannabis, cannabis is used a lot in Prince Albert and in Halifax. And then, interestingly enough, you see less of it in a city like Vancouver. Cocaine, this is probably not going to be news to anyone that's worked in this industry for a while. It's certainly not to me that grew up in Alberta and had most of my friends working in oil and gas. Cocaine is heavily used in resource communities. That's where we detect it. Cocaine and other stimulants. And then less so in other communities. You can see that big spike in Prince Albert. And then ecstasy is a club drug, is a party drug. And so you see it used in Vancouver, you see it in Montreal, basically big cities, and then less so in other places. But basically, we're seeing drug use up everywhere across the country. Fentanyl is probably the deadliest one out there. It's detected in about 80% of overdose deaths right now. And as you probably know, fentanyl is about 100 times more potent than morphine, which is why it's so addictive. And then the new kid in town, which is something called carfentanil, which is being produced synthetically in Canada right now, is 10,000 times more potent than morphine. So just an enormous high, an enormous addictive potential, and just something that we're really struggling with right now to overcome in Canada. So what do you do about all this? So I'm actually an optimist, and I think there's actually a lot of practical things that we can do in our lives to overcome all these health challenges. One of the most important ones is actually, it's very mundane, but it's sleep. And it's something that really came to the fore for me at this conference because of all the folks that work underground and in mines and in remote areas, and where it's very, very disruptive to people's sleep. But we've got mounting amount of evidence that shows that sleep is absolutely crucial to maintaining a healthy weight, to preventing diabetes, to preventing dementia, preventing depression, preventing a whole host of chronic illnesses. Getting enough sleep is important, and it's the quality of the sleep that matters. It's not just the total amount. And so we're really advising people to monitor their sleep. And now there's new technologies that are available, on your iWatch or on the Oura Ring, or all sorts of different wearables that are not particularly expensive that can actually track your sleep. And you don't have to do this forever, but you track it for a couple of weeks and actually tell you what the quality of your sleep is, and help healthcare professionals intervene to help you get better sleep and to mitigate some of these other health outcomes. Fuel, basically what you eat. We don't eat enough protein as Canadians, and with this inflationary environment where everything is super expensive at the grocery store, we're really seeing people's protein get hammered. But protein is actually by far the most important component, and substituting it with other parts of the food group isn't adequate. So we're advising people get more protein, and then again, there's new monitoring technologies that are coming off the shelf now to help us actually monitor what different foods do to your insulin and your blood sugar. So instead of getting into yo-yo diets and guessing whether keto is right for you or Atkins or whatever, you can actually measure what different foods, like if you eat a slice of pizza or eat a bowl of rice or whatever, you can actually see how your unique response is to these foods and actually plan out your diet to maximize your health and actually normalize your weight, for example. And then finally, mental health, I think it goes without saying, is pretty underestimated. Therapy is more widely available. It's something we do at TELUS Health, and we promote that, and we provide that to many of our clients around the world. It's never a waste of time. As a clinician, I often get approached by people who wonder, like, is it a waste of time? Like, am I wasting your time, Dr. Chow? You're a specialist. Why am I here? Like, why am I wasting your time? And I'm like, you're not. Nobody has ever wasted my time getting treatment, getting help. If anything, I always wish they'd come sooner and address the issues sooner. Some stuff about productivity. We are a society that's chronically getting interrupted all the time. We're getting interrupted by phones. We're getting interrupted by chat messages, DMs. It increases your cognitive workload many times over every time you get interrupted. In fact, every time you get interrupted, it takes about 23 minutes. Someone's actually measured this. It takes about 23 minutes to get back into the rhythm of what you were doing before. So just getting pinged by somebody, let's say you're typing an email or you're working on a truck, right? You're driving a truck, and you feel a buzz in your pocket and you kind of attend to it, which you shouldn't if you're driving a big truck, but let's say you did. It takes actually about 23 minutes to get back fully into the zone of what you were doing before. And so you multiply that by how many times you get pinged every day, and you can imagine the reduction in productivity. Whereas deep focus, like getting in the zone, really, engaging your creative juices, really attending to safety, it takes deep focus. It requires uninterrupted time, and that's why there's so many safety procedures and protocols around, minimizing interruptions. And then finally, social media. This is something we've really seen during the pandemic. Social media is, I'm going to be just very blunt here. It's a pretty toxic place these days, and we're seeing the most toxic impacts actually on our kids. So I subspecialize in child and youth, and I used to be a clinical professor at BC Children's Hospital. And what we saw with kids and social media was devastating. We're seeing girls getting into eating disorders because of social media. We're seeing boys getting bullied or bullying other people. We're seeing a lot of toxicity growing, and there's more and more research that's showing that social media is actually probably damaging to kids' health. And that's what's leading to all this recent, you'll see different provincial governments talking about like limiting cell phone use, limiting social media use. That's what's driving it, is because we're actually seeing this in our hospitals. We're seeing this in our mental health clinics, what social media does. And so I'm often advising people to like cut back on your social media use. And I've even deleted the apps off my own phone to get away from some of that. And then finally, this is my last slide. And then I'm happy to take questions outside and around the conference today. Movement. So we are learning more and more about the benefits of exercise, and that getting movement into your day is so important, especially if you spend a lot of your job and your working time sitting. Sitting is like the new smoking, we say in medical circles. And so getting movement into your day is super, super important, and it can be as short as 10 to 30 minutes a day. And the key here is, and again, this is where measurement's important, getting your heart rate up to 50 to 70% of your maximum seems to be the sweet spot in terms of health benefits. And so your heart rate maximum you can figure out by just taking 180 and subtracting your age. So 180 minus your age is around your ballpark of what your maximum heart rate is. And so getting your heart rate to about 50 to 70% of that is the sweet spot for getting the most health benefit. And then finally, social connection. I talked about how being lonely is equivalent, as damaging as 14 cigarettes a day. Getting people back involved in social connection, and I was chatting with someone in the exhibit hall earlier about this. She said, people spend so much time on their phones these days. They go to their job, they get home, then they're just on the internet and they're streaming or whatever, and they're not really talking to each other or talking to other people. Turns out we need social connection. It's not optional. And so when we isolate people for long periods of time, it's actually incredibly damaging, not just for their mental health, but actually their physical health as well. We actually start to see them deteriorate physically. And so investing in social interaction, getting off your phone, being with people is so crucial. And so, like I mentioned earlier in my talk, the US Surgeon General is actually examining this now as a public health crisis of our time, is this lack of social connection. It probably worsens dementia for elders. It probably increases chronic disease for the elderly. And it's not helpful for our youth, and it's not helpful for all of us at working age as well. And then finally, the last thing is, and this might sound sappy, but it really has borne out in my practice, just being thankful and having perspective. So there's evidence that shows that people who spend a little bit of time each day, even like 2 minutes, each day just reviewing like what they're grateful for, the people that they're grateful for, maybe something delicious they ate, something funny that happened at work. Like just people that actually spend some time thinking about what they're grateful for live longer. They live longer, they live healthier. We don't know why. It's almost like magic, like why this happens, but they just do better. Even their blood pressure is lower from being grateful. And so this is something I teach now as well, is that just think about something, you can even try it right now. Just think about like today, something that you're grateful for. Maybe it's the coffee at the conference. Maybe that, you got a helpful email or helpful ping from somebody. Maybe you saw a colleague that you haven't seen in a long time. But just think about something just right now that you're thankful for, you're grateful for. And if I were to put a monitor on you, your heart rate and blood pressure would actually come down. And your blood sugars would actually normalize just when you're thinking about that. How does that work? I have no clue. That's for smarter people to figure out. We just know that it does. And it's very, very consistent. Just like having social connection. After people have talked to a friend, after people have been to a party, after people have been to the pub, after people have exchanged jokes with work colleagues, their blood pressure comes down, their blood sugars normalize, like everything's just healthier. You can even see it in brain scans. It's like magic. So take sleep seriously, address your mental health, and there's a lot more resources, and I'm happy to chat with people about how to get resources to people, especially in rural and remote and resource extraction sites, because that's absolutely a challenge that we're ready to tackle in terms of like addressing people's mental health. And one area we're really interested in now is not just the mental health of workers themselves, but their families. It's a full unit, right? And so when people are spending a lot of time away from their families and then coming back home to their families and going back to the mine or a camp or a work site, everybody's mental health can be affected from that. And so we're really looking at actually figuring out how to support people both at the work site but also at home and also their families, because it just helps you have a healthier workforce and also reduces the amount of sick time, disability time, time off, and just like having to recruit new people because people get burned out. Fueling your body, getting more protein, getting movement as part of your day, and it doesn't have to be a lot, like even 30 minutes, 10 minutes, 20 minutes, anything is better than nothing. And then, maybe controversially for me to say this, but like turn off your news and social media feeds. There's a lot of negativity online, there's a lot of toxicity. How much of that do you really need every day? And take it like dessert, eat small doses. And because we are seeing that impact on your health. So thanks for having me. Happy to take questions later on and enjoy the rest of your conference.